Hello. Today I'm going to be presenting the role of nurses in electronic health record utilization and best practices. So we're going to begin with the overview of the hospital, which is West Kendall Baptist. So West Kendall Baptist, part of the Baptist Health South Florida, opened in April 2011 as Miami-Dade County's first new hospital in over 35 years. Situated on a 45.5-acre campus, the hospital is LEED Gold certified, reflecting its commitment to energy efficiency and environmental sustainability. The bed capacity of West Kendall Baptist Hospital: the hospital features 203 private rooms, providing comprehensive care across various medical and surgical services. This includes a dedicated critical care unit and an emergency department equipped with 69 private treatment rooms. The Beautiful Beginnings program for expectant mothers includes all private labor and delivery suites, dedicated C-section operating rooms, and a level 1 NICU/special care nursery within the labor and delivery unit. Services provided at this hospital. So for cardiovascular services, they have the cardiac catheterization lab. For emergency services, they have the emergency department. For neurosciences, they have the electroencephalography. For orthopedic services, they have joint replacement. Other services include hemodialysis and obstetrics. They also, for radiology, nuclear medicine, imaging, they have computed tomography angiography, and magnetic resonance imaging, also known as MRI. For rehabilitation services, they have physical therapy and speech therapy. For special care, they have the intensive care unit, and surgical services are inpatient surgery and robotic surgery. So, for ensuring patient safety, nurses, practices, and medication administration, there's the 8 rights of medication administration that nurses adhere to. The first one being the right patient, verifying the patient's identity using at least 2 identifiers, such as name and date of birth. The right medication, confirming that the medication matches the provider's order and is appropriate for the patient's condition. The right dose, ensuring that the dosage is correct, considering factors like age, weight, and renal function. The right route, verifying that the administration method is appropriate. The right time, administering the medication within the prescribed time window. The right documentation, accurately recording all medication details in the patient's medical record. The right reason, understanding and confirming the rationale for the prescribed medication. And the right response, monitoring the patient for expected outcomes and adverse reactions. Patient identification verification, so comparing the patient's wristband with the medication administration record and asking the patient to confirm their name and date of birth. High alert medication protocols, double check process. Two registered nurses independently verify medication, dose, and route. Special handling. High alert medications are stored and labeled distinctly. Guideline updates. Policies are regularly reviewed and updated per best practices. Allergy verification. Every medication administration begins with a thorough check of the patient's allergies. Nurses check with the electronic health record for documented allergies and confirm with the patient. Standardized communication. Clear communication is important. During medication administration, nurses use tools like SBAR to share medication details, ensuring accuracy and reducing errors. Ongoing education and training. Nurses undergo regular training to stay current with the latest medication safety protocols and technologies. This training covers the proper use of barcode medication administration systems, strategies for managing high alert medication risk, and how to identify and handle potential drug interactions and side effects. As well, there's the patient education. Nurses educate patients on medication purpose, dosage, side effects, proper administration, and provide clear written instructions. So, safety measures in EHR systems. So, enhancing patient care at West Kendall Baptist Hospital. So, at Baptist West Kendall, the electronic health record system is powered by Cerner Millennium. It includes safety measures designed to improve patient care, reduce errors, and simplify workflows for healthcare professionals. So, some of the safety measures in this EHR system is the barcoded medication administration. Barcode scanning helps ensure safety by matching the patient and medical medication to the prescription, while real-time alerts catch any mismatches. These tools reduce errors, improve accuracy, and support the 8 rights of medication administration. There's also clinical decision support tools. This tool assists healthcare providers with alerts for high alert medications like insulin, anticoagulants, as well as standardized orders to, to ensure the best practices. These tools enhance decision making with real time evidence based recommendations. There's also automated documentation and timestamping. Cerner's EHR automatically timestamps medication administration and tracks record access with audit trails, ensuring accuracy, accountability, and easier quality audits. It also has task prioritization and scheduling. The EHR helps nurses stay on track by scheduling medications with reminders and providing dashboards to manage tasks, making it easier to stay organized and ensure doses are not missed. There's also real time communication and interdisciplinary collaboration. The EHR keeps everyone on the same page by updating patient orders and lab results in real time. Nurses can also use built in messaging to quickly reach out to pharmacists or doctors, improving communication and speeding up care. So, assessing nurse driven safety measures and EHR system effectiveness. So, an evaluation of barcoded medication administration. So, the barcoded medication administration improves patient safety by verifying medications with prescriptions and offering real time alerts to support the 8 rights of medication administration. However, its effectiveness can be hindered by issues like scanner malfunctions, unreadable barcodes, and staff workarounds. So, some recommendations that I give for nurse leaders is to make the BCMA effective. Staff need proper training, and equipment should be reliable with quick fixes for any issues. Regular audits can spot gaps in compliance, and fostering a safety culture encourages error reporting and staff input on improvements. So, the evaluation of clinical decision support tools. So, clinical decision support tools helps improve patient safety by providing alerts for high risk medications and standardized orders set to support evidence based care. However, challenges like alert fatigue, system overrides, and over reliance on the tools can limit their effectiveness and affect clinical judgment. So, some recommendations for nurse leaders is to make the CDSTs more effective, work with IT to reduce unnecessary alerts and prevent alert fatigue while keeping critical warnings intact, offering ongoing training to help staff use the tools effectively while relying on their own clinical judgment. Encourage nurses to share feedback to improve alert relevance and integration into workflows, and regularly review system usage to address overrides and keep alerts aligned with current guidelines. So, the evaluation of the automated documentation and timestamping. So, Cerner's EHR's automated documentation and timestamping improves accuracy and accountability by recording exact times and keeping audit trails. This ensures compliance, which makes audits easier and lets nurses focus more on patient care. However, issues like data entry mistakes, system downtime, and a lack of training on using audit trails can reduce its effectiveness. So, some recommendations to nurse leaders. So, train staff on using automated documentation and audit trails. Encourage them to double check entries and work with IT to resolve system issues quickly. Use audit trail data to improve workflows, ensure compliance, and boost accountability. So, evaluation of task prioritization and scheduling. The EHR helps nurses stay organized with medication schedules, reminders, and dashboards, reducing missed doses and improving workflow. However, over reliance on the system, incomplete updates, or cluttered dashboards can make it less effective and lead to missed tasks. So some recommendations to nurse leaders is to train nurses to use the EHR dashboards effectively and prioritize tasks based on urgency. Simplify dashboards with it, support to make tasks clearer, and encourage manual checks to catch any discrepancies. Regularly review how the system is used to address challenges and improve its functionality. So, evaluation of real time communication and interdisciplinary collaboration. The EHR provides real time updates, keeping everyone informed and improving coordination. Messaging tools let nurses quickly reach out to pharmacists or doctors, speeding up care. However, issues like incomplete updates, slow responses, or relying too much on electronic communication can sometimes cause delays. So, some recommendations for nurse leaders is to encourage team members to respond to EHR members quickly to avoid care delays, and train staff to use messaging tools effectively. Knowing when to escalate urgent issues and use face to face communication for complex situations, and work with IT to keep updates reliable and address technical issues fast. So, here's my references, and thank you all for listening me today.